have trouble falling asleep?
Do your hands feel like they're trembling quite often?
Are you losing weight unintentionally?
Do you have an increased appetite? Lisa, can I help you with that?
I'm fine, just stop bothering me.
Are you feeling irritable?
Can't lift it.
Are you experiencing muscle weakness lately?
So cold.
I am so hot up here. Oh my god, it's so hot.
Are you hot all the time?
I can't. I just feel so tired lately and I'm so anxious.
Are you experiencing any fatigue, anxiety, or even depression lately?
Then we've got a drug for you.
Hi Lisa. Hi, I'm Tess. I'm gonna be your nurse today.
Hi.
How are you feeling?
A little anxious.
Okay, so your doctor prescribed you Methimazole, which is a hyperthyroid medication, and I think it's gonna help your and suppress your symptoms you've been experiencing due to your hyperthyroid. So I'm just gonna explain some important facts and things you should know about the medication before you take it. Methimazole is more commonly known as Tapazole. So you're being prescribed this because it's going to suppress the hormones that's being released from your thyroid.
Okay. When do I take this medication?
So you're going to take 5 milligram tablets. That's what your doctor prescribed you. You're going to take them 3 times a day, every 8 hours.
Do I take it with food?
So you're going to take it orally, and you can take it with a cup of water, but you don't necessarily have to take it with food. Just make sure that you take it the same way each dose.
Okay.
And then, so make sure you don't stop the drug quickly or miss any doses or anything. And then if you miss a dose, make sure you don't double up on a dose.
Okay.
You should also, just let you know, you should also schedule blood work periodically when taking this medication, because although it's rare, very rare, there's a possibility that it could lower your white blood cell count. So you want to just monitor that so you can fight off infections.
Okay.
And so I'm also going to monitor your PTT and your INR because there's a chance that you could be more prone to bleeding. And so it's important that if you're experiencing any skin rash or swelling of the lymph nodes or unexplained bleeding, sore throat, fever, or jaundice, that you call your provider, and because you might have to be switched off of it.
Okay.
Is there any chance that you're pregnant at all?
No.
Okay, so if there is ever a chance that you are pregnant, please notify your provider and let us know, because on this medication you're not supposed to be taking it. Because
If I don't want to take it anymore, can I just stop taking it?
So don't abruptly stop taking the medication. Call your provider and we can schedule an appointment and try to switch you onto something else. But make sure you continue taking it.
Okay.
Any other questions today?
I don't think so.
Okay. Thank you so much for coming in today. If you have any other questions, don't hesitate to call us. Thank you. Bye. You feel better.
The therapeutic effects of methimazole result from blocking synthesis of thyroid hormones. 2 mechanisms are involved. First, methimazole prevents the oxidation of iodine, thereby inhibiting the incorporation of iodine into tyrosine. Second, methimazole prevents ionated tyrosines from coupling. Both effects result from inhibiting peroxidase. Also used for decreasing symptoms of hyperthyroidism in preparation for surgical removal of the thyroid gland or before inactivating the thyroid gland with radioactive iodine. This medication is readily absorbed from the GI tract. Usual dosage available in 5 to 10 milligram tablets, should be stored at room temp. 15 milligrams a day for mild hyperthyroidism, 30 to 40 milligrams a day for moderately severe hyperthyroidism, 60 milligrams a day for severe hyperthyroidism. Daily dose is divided into 3 doses administered every 8 hours. Maintenance dose is 5 to 15 milligrams a day. Side effects of this medication include headache, rash, itching, hives, abnormal hair loss, and skin pigmentation. Other common side effects of this drug include swelling, nausea, vomiting, heartburn, loss of taste, joint or muscle aches, numbness, and headache. Serious adverse effects include edema, swelling of the lymph nodes, agranulocytosis or loss of white blood cells, vertigo, jaundice, lupus-like syndrome, nephritis, thrombocytopenia, and death of liver cells. This drug can reduce anticoagulant effects of warfarin, may increase serum levels of digoxin, may alter thiopyline levels, and your prescriber may need to decrease dose of beta blockers. Patients should maintain adherence to the established dosage regimen. Do not double, decrease, or omit doses, and do not alter the interval between doses. Be aware that skin rash or swelling of cervical lymph nodes may indicate need to discontinue the drug and change to another antithyroid agent. Patients should notify their provider. Notify provider promptly if the following symptoms appear: bruising, unexplained bleeding, sore throat, fever, or jaundice. Drug-induced jaundice may persist up to 10 weeks after withdrawal of drug. Do not breastfeed while using this drug. This drug may induce hypothyroidism in very high doses. If this occurs, dosage should be reduced. This drug is an FDA pregnancy category D. Do not use methimazole if you are pregnant. Use effective birth control and tell your doctor if you become pregnant during treatment. Do not take methimazole if you are breastfeeding a baby. It is excreted in breast milk and may potentially cause harm to the infant.
Change your life with Methimazole today.